Hello and welcome from Queen Camel Medical Centre. I'm Dr. Hewins and we wanted to explain the changes we're making to keep you, our patients, as safe as we can, as well as our staff. As you know, coronavirus is spread by droplets and passed on by coughing and by touch. We're therefore minimising the face-to-face contact to avoid spread in the waiting room and potentially catching it from us. We're moving to a total triage system, which means that we will phone every patient before further contact is made. We're making maximum use of phone calls and we've introduced video consultations as well. If you feel you have come into contact with coronavirus or you have any symptoms, please contact 111 either online or by telephone and do not come to the surgery. What you can do to help us and therefore help yourselves. Please could you register online with EMIS Access? Make sure your telephone, mobile and email addresses are correct. Please refer to our website where we'll be explaining the best ways we can help you. If we give you a telephone appointment time to phone back, we will do our utmost to ring at the appointment time, all within 30 minutes. Please could you make sure your phone is on, charged, not on silent and in an area of reception. We will try once to call you, but we will have difficulty to call you more than that due to the volume of work. I would advise every household to have a thermometer, and also if you have high blood pressure, I would suggest you buy a blood pressure machine from the chemist. They're quite cheap. Get an arm one, they're more reliable than the wrist ones, and you can monitor your own blood pressure and let us know the readings if you're concerned. If you do need face-to-face contact, we are keeping the building as clean as we can. We are asking only patients and carers to come into the waiting room. We've moved tables in front of the counters, both in the dispensary and the reception. It looks a bit odd, but it increases the distance to reduce spread. Please could you use the hand gels and also wash your hands in the sink as you come in. If you need to be seen and have a fever, then we have a fever room. So the process will be that we will ask you to stay in the car, in the car park, and at your appointment time we will ring you on the mobile and ask you to come in the side door on the left-hand side of the building into a room which we're keeping purely for these purposes, and we will see you there and then let you back out the same way. If you need a home visit, we will organise that on the telephone. We're quite likely to have a skeleton staff at some point, with staff needing to self-isolate. We're trying not to restrict the service we're providing. We just want to make it safer for you and for our staff. We've got some dedicated and excellent staff who want to do their best for you in these difficult times. Thank you.